Dun, dun, dun. And we're live on Suzilla.
Hey, welcome back to Suzilla. It is January
20th.
20th. It's the 20th of January, 2022. I'm Susie. That's Matt.
Hey.
We're Suzilla, broadcasting live from the Susie Health Solutions Enrollment Center in Wenatchee, Washington.
Yes, we're one of the 11 enrollment centers in Washington State.
Yep.
We literally help people get insurance.
Yep, exactly what we do. That is our goal. But from individual plans to life insurance to Medicare to travel insurance to dental. Yes, this is your advertisement for the day.
We're kind of weird that way.
We are,
but that is kind of being ethical.
Yes, we are doing our continuing education this week because the annual enrollment period is finally wound down. Mm-hmm. And so we're starting our CE because we both have spring birthdays.
Yes.
And it's renewal time.
Every 2 years we have to have 24 credits with 3 ethics.
3 ethics hours, yes. And as the fact that I'm still holding my licensed pharmacy technician license, I have 20 hours of CE, including an hour of law.
Ooh.
Every year.
Okay.
Yeah. So
well,
that's done already, by the way.
Yeah, I know you did that earlier. So that brings us the topic of the day, which is do it yourself versus the experts.
Yeah, we did run into. We had one of our good friends point us at a
TikToc.
Someone was having a hard time because they went to the emergency room.
Yeah, they went to the emergency room in December. They accrued themselves a bill of $9,300. They're in Kansas. Mm-hmm. We feel bad for them because we do. Not all states are created equal when it comes to healthcare.
Absolutely true. We know this for a fact that some states are not as don't have as usable of plans.
Well, it's not just usable plans. Their focus is not really on consumers.
No.
And they're focused more on wealth extraction. It's a good way to put it. Was wealth extraction.
Yeah.
And in a very haphazard manner.
Okay, how haphazard? What do you mean by haphazard?
When you instance for if you're out there and you're a sheep herder, you have to fleece your sheep.
Right. Shear your sheep.
You don't want to cut your sheep because that's too cut.
It's bad for the sheep.
Yeah,
and
it's bad on your blades, and it
makes the sheep unhappy. They don't want to get sheared in the spring, but they have to be sheared because domestic sheep have to be sheared.
Yeah, or else you end up with like big old mountain of woolly mass.
We've all seen that.
Yeah, we've all seen those. Really found in 20 years in Australia cave.
Yeah, and that's literally
look miserable.
And that is very unwell for them. That's very unhappy for the sheep.
But you don't want to come. And I'm going to use that as kind of a baseline. It's like, yeah, they're coming, kind of running at the sheep with blind clippers and hoping it'll turn out well.
So they're running at the sheep with like, what's a good analogy? Like hedge clippers instead of shears.
Yeah. And you don't have to do that. It's just like, that's bad. And we're well beyond that.
The sheep analogy.
I know I didn't start the sheep analogy. So yeah, it's one of the ones that's like, talk to your experts, figure out. And, there's been kind of this weird backlash the last decade or so of let's stay away from the educated folks.
Well, okay.
And experts are educated
folks. Now, I personally do not have a college degree, but I have taken time in my life to become educated about what I do for a living.
Well, yes, you take courses and you advance yourself.
But would I be looked at as an educated person because I do not have that degree?
It depends on how, because part of a profession you have a customized vocabulary.
That's true. It's very important to be careful when you're using your customized vocabulary with people who are not used to the customized vocabulary.
Correct. But if you sat there and hit everyone and talked about, oh, this is deductible, this is a premium, this is how everything works, and that's all you interface people with,
right?
and we're basically a very bad insurance agent,
which I'm not. Thank you very much for asking.
You would be seen as one of those
experts.
One of the experts, and you've got to be able to break it down simply.
Yes,
because we're that weird interface between companies and products,
right? And the companies don't care about how the consumers understand their product. They just want the consumer to buy their product.
Yeah, it's the butts in chair.
Yeah, there you go. Butts in the chair.
And we laugh at that, and we that's an old phrase I had a district manager lay on me, and we watch. I can't remember what the last movie was.
Something about butts and chairs.
It was Mr. 3000.
Yes, Mr. 3000, the old movie with Bernie Mac
and Chris Noth.
Bernie Mac was a baseball player. Chris Noth owned the general manager or owned a baseball team, and he was more interested in
getting people
to. He said, "Okay, you're not going to go on tour because if you hit your 3,000th hit while you are out on the road, I won't get my butts in my seats in my stadium."
Yep. And that's what it boiled down to.
Fun little movie. It's entertaining. Go take a look at it. It makes you miss Bernie Mac.
But that there are some in large corporations have that concept,
that mentality.
They don't want to advance the game. They don't want to advance the players. They just want their butts in the chair.
They want to advance their profits. Well, yeah, we've run into that's a corporate mandate these days.
However, that's not a professional one.
No, corporate and professional are not synonymous.
Because when you operate in an ethical manner, you have to forego short-term profits. And actually, the what we operate under, and it's one of those things I giggle every time I see. The golden rule, do unto others as you would have them do unto you.
Yeah.
And that's literally what drives the ethics behind an insurance producer.
That's right. That's one of the things they actually use. The moral imperative?
Yeah.
Yeah, the moral imperative. And that's do what's right for your client.
Yeah,
it's the number one rule.
Yeah, it's you have to have it, and it's regardless of what your personal profits are,
or your personal opinion.
You put the client first.
You deal with their needs, assess their situation, and get what's right for them. That's what an ethical insurance producer does.
Yeah, and so you're going way beyond of the instinct. It's not transactional. It's not walking into that 7-Eleven, pulling a lever, saying, "Oh, I got $1 million in liability."
Yeah, we've talked about the slushy machine before. You can't just walk in and go, "I want that long-term care policy," and expect someone to hand it to you immediately.
Yeah.
It doesn't work that way. Same thing with health insurance.
However, that is the point of a lot of legislation is to sit there and oh, they don't need that ethical component.
Well, see, that's where the Affordable Care Act messed up, because they tried to make it consumer friendly with this lovely little, here's your website, just go do this and you'll be fine. But they did not take into account the fact that the phrasing, the specialty words, the site itself, it's confusing for your average Joe.
Oh yeah, well,
even your above average Joe.
It's trying to eliminate an ethical profession.
Yeah, that ticked you off so bad.
Well, it ticks out a lot of insurance producers.
Yeah, it does.
I'm on the other hand, it's like there needs to be some give and take, and there needs to be some assessment of the consumer.
Exactly.
And that's part of what we do is we assess, what's your needs? How do you use this?
Exactly. That's one of the first questions we ask. How do you use your health insurance? One thing I want to be absolutely clear about to our listeners is we're not saying if you can't use the exchange, you're dumb. I have had people who have been in the insurance industry for decades can't get their heads around this thing.
Tough.
It's tough. I know how to do it because I have spent hundreds of hours working with it and studying it, and I still get stumped sometimes. and bring Matt in. He does the very same thing.
Yeah.
Because we work well as a team, we can bounce stuff off each other, and we have resources to answer questions if we get stuck. And yes, we still get stuck after 9 years.
Yeah, after 9 years, we're well over, between the two of us, over 1,500 applications.
Mm-hmm. We've done hundreds of these.
Yeah,
really.
We're into the thousands now.
Yeah. I'm not gonna say thousands until
and they tweak it regularly and they update it. Mm-hmm. So it's not a very easy thing. One of the things I saw recently, and I just like, what are these guys thinking of? And this is that whole educated elites thing.
Yeah.
One of the things that they were complaining about was creation of email addresses. And we actually ran into this really heavily the first couple of years, and we still run into it occasionally.
Yeah, people who don't have email.
Yeah, and that's one of those things that is they're good. The CMS is really going to hammer that on creation of email addresses.
Yeah,
and there are folks that point blank do not do business using email.
No, and they won't for one reason or another.
Mm-hmm. And
I've got people that don't even own computers.
I know.
Or smartphones. Mm-hmm. It's like, no. Yeah. They just won't. They're as far off the grid as they possibly can be. Mm-hmm. But they still need health insurance.
And they still need health insurance. And that's a clash of cultures.
It is. And that goes back to the educated elite. It's an assumption that everybody's got what I got.
We got what you got. And one of the things is we stress, it's like, yeah, we regularly do our best to outreach and talk to these educated elite and say, hey, mm-hmm. these people need to be taken care of. Mm-hmm. And that's part of kind of, I don't know, is it a circle of life there?
I don't know. Triangle of protection?
Triangle of protection.
Well, that's for earthquakes.
And, we do our best to reach out to the legislators because that's what drives it. That's what drives insurance. The minute everyone says, "Oh, get your hands off my health care," and it's one of those like, really? Do you know on how bad it was beforehand? I've seen some of the horror stories.
Yeah.
The reason why you have to insure for life insurance your foster kids the same way you do your natural born kids is because at one point there was folks out there killing their foster kids because they overinsured them.
They were killing them for the life insurance policy.
Life insurance.
Yep, that really
there
happened.
Are some that really happened. There are horrible people out there, and that's why they create laws to protect some consumers. So yeah, it's one of those things. So this gal, she was on TikTok.
Yep.
Our friends said, "Hey, you need to reach out to this person." I don't know, because she incurred a bill of $93,000. She's in Kansas.
$93,000 or $9,300?
$9,300.
She's in Kansas. She had an emergency room situation.
Mm-hmm.
She didn't have health insurance.
Yeah.
In
December.
Yeah,
it was December.
So if she didn't have coverage in 2021, she wasn't going to be able to get something. Although all the way through August of 2021, she could have picked up an insurance policy.
Yeah, we ran in Washington State, in most of the states that ran the federal hub.
I don't know if Kansas did the federal go out that far?
The federal went out that far on August 15th because of the American Rescue Plan Act.
Right, ARPA made a huge difference,
and we hammered our representatives to say, "Hey, you really need to talk about this because this puts thousands of dollars in people's pocket and gets them insured."
Mm-hmm.
We wrote people who were unemployed these awesome platinum mobile plans for under $10 a month.
Mm-hmm. That's expired.
That has expired that last year. They were working on extending it out with the Build Back Better Act, mm-hmm. which has got hung up in the Senate.
Right.
We told our people, hey, you need to talk about this. The more you talk about it, the more people will enroll, the more. Oh, we wrote our little fingers off almost all last year, trying to get people covered in our state.
Absolutely. You should see my calendar. It was booked solid all summer long.
Yeah.
We did manage to get right after the end. But we did mention take a week off at the end of August before
Correct.
school started because we really needed to do some self care there.
Yeah, and so there was folks out there writing this stuff like crazy. One of the things that the Biden administration did was work on increasing outreach.
Yes, which was nice.
Which is incredibly helpful because it empowers folks to professionals or at least trained individuals to go out there and say, hey, let people know that there are people out there that can help you understand this stuff. And that's very important. It is to get out there and get out of our little information silos. Hey, yeah, COVID's going on. It's no big deal. Most of us have got.
No, it's a big deal.
It's a big deal. Yeah. However, it's no big deal to do it over the phone or with screen sharing.
Yep, we can do virtual chats all day. I love virtual chats.
Oh yeah, the virtual chats are one of those pride and joys with us because we could sit there and actually see people's faces.
Yeah, and they can see ours.
Which
I've missed.
So it was one of those things because we recognized early that there are some folks that do not have access to those and needed to do it in person because they needed hard documents. That's part of us being a professional.
Yep.
It was responding to that client need.
Yeah.
And we opened up and we ran with masks, and we're still running with masks. We have a room that's big enough that, we could socially distance in all our rooms.
Yeah, which is awesome, actually.
And I got, plenty of sunlight in the front room. So
I'm a little jealous about that.
Well, hey, you come out and join me anytime. So, yeah, we responded to the customer's needs and moved forward. However, for whatever reason, this individual did not get it.
Yeah. Well, if she had been in Washington State, she probably would have seen one of our ads. She probably would have had somebody who'd heard about us go, hey, go talk to them.
Yeah, we actually we tested Google Ads.
Yeah.
And we spent $1,000.
Yeah.
To go out there, do some outreach with Google Ads. And the top rated thing to find healthcare in North Central Washington was Suzilla Solutions.
Yep, we kind of did pretty good there.
That's on how big it was, and it's okay. We've successfully branded. We're not finding new people that way; they're finding us.
Yeah, exactly, and that's a good thing.
I
don't think Kansas they must not have enrollment centers like we do here.
Enrollment centers, as far as I know, are a Washington State thing.
Which would I encourage other states to jump on this bandwagon because it's kind of nifty.
Because what it is well, actually, I think there's only 8 of us that are insurance brokers.
Still, that's more than
insurance producers,
right? Others are navigators, and there's nothing wrong with that.
Well, they're not run by navigators; they're run by lead orgs.
Oh, okay. But they hire navigators,
and who hire navigators,
right.
Which is kind of a really confusing concept.
Yeah, if you want to know more about it, call us. We'll explain it.
Yeah, it's one of those weird little niche things. However, lead orgs run the navigators. Navigators do outreach. We also know that there are informal networks out there.
Absolutely,
because I've helped out with ACA signups and a couple of the other groups out there that are promoting it. Out to Enroll,
yes,
is one of the ones we're listed with the Young Invincibles.
Yes.
So yeah, there is outreach out there, and we're coming up this year will be a decade.
I know, it's amazing, isn't it?
So it's one of those ones. It's like, okay, we're going to keep talking about this, and we have customers come in. It's like, I didn't know there was an open enrollment.
I know, and
it's like, really, we've talked about it for almost a decade now.
Yeah, we've had the whole conversation every year. We have at least 2 or 3 people going, I need health insurance. Well, you missed the enrollment period. How come I just can't get insurance when I want it? Because of people like you who just discovered you got, a disease, you want to go get treated, so you decide you want health insurance then. It doesn't work that way.
It hasn't worked that way in a decade.
Ever.
Oh yeah, ever. Because before the Affordable Care Act, if you had a disease, they would deny you care.
And that's right. You would be hit with a pre-existing condition rider at least, if they didn't just straight up deny you. If you were working for somebody and they offered you health insurance, you couldn't just jump in to the group plan because you suddenly came down with a disease.
Yeah.
It doesn't work that way.
Yeah,
being ill is not a special enrollment reason.
Nope. Being ill, being injured, or getting pregnant.
Nope.
You don't automatically get you health insurance.
No, it doesn't.
When you want to enroll, we tell people, hey, if you don't have insurance, work on the enrollment. You can find out, and that way you can find out if you've got to qualify for a special enrollment.
Correct. Sometimes you do, and you don't even know it. Sometimes your income is low enough you get Apple Health, which is our Washington State Medicaid program.
Well, think about on how many people we've actually ran through a couple handfuls of individuals that qualified for Native American health.
Also, then
did not know
have a flippin' clue about it. Well, and then there's the child care worker thing.
Child care worker in Washington State.
Yeah, in Washington State, that's a special enrollment situation.
Yeah, we started that last November.
Yep. Haven't had a huge
we still got
it yet, but we've got a handful of people.
Yeah, we've got a handful of people. So that's why it's important to, if you don't have health insurance, enroll, do the application and find someone that can walk you through it.
And that way you've got a baseline for if you can't get in right away because you don't qualify for any of the special enrollment reasons, we can get you in for the really easily and quickly for the following
because you have a application that is set up and ready to go. Here's the crazy thing. We've got a calendar program. We've got folks that have
I've got scheduled up to 2024 at this point.
Yes, that started last year because they're going to age into Medicare and they know automatically, hey, this is the person they know that they're going to be around. They can simply set the calendar appointment, and lo and behold,
they'll get a reminder.
They're going to get a reminder. Oh, yeah, I had to do this.
And I'll get a reminder.
And Susie, well, actually, we can go in and
we go, but but I get reminders as well.
So it's kind of nice that you can, if you've got things like that going up, because we run into the age ends.
Yeah. Or age outs.
Age 26.
26. You lose coverage from your parents' plan.
And, there are some times that we've encountered that you don't want to be on your parents' plan for a particular reason.
So you go so you go jump early.
You control it.
That is an opportunity that could be considered going off of your parents' plan is an SEP situation.
It is a special enrollment. You got 60 days.
Right. 60 days is a very key number.
Yeah, and we see that, that number over and over and over again. Here's the thing. You can sit there and do the application, have it done, and do the, I'll see if I get another job because it's going to be quick. You can change that plan anytime. You can drop off. It's like, I got a plan! Yay! Good for you! We literally clap on people getting in line, and it's like, we'll turn it off, and it goes off.
It's literally 2 clicks.
Yeah,
literally 2 clicks. I've done it. Heaven knows how many times. You got a job. That's great. Congratulations! You got coverage. Great. Click, click, and then they're done. That particular policy is terminated. You're not required. You're not glued to it unless you need it or want it.
So yeah, it's having experts in your back pocket is incredibly helpful.
We're valuable. The experts in your pocket are valuable. I've used this analogy before. You drive a car. You have a transmission. You have a transmission. You don't know how to rebuild your transmission, but if you're smart, you have somebody in your life who does know how to rebuild your transmission. And no one expects you to know how to do it. You bring in the experts around you who do, just like us. You might not quite get how to do the enrolling in the healthcare, but you bring in somebody who does. It's creating your team of experts around you. That's a good thing. Your financial planners, your insurance people, your mechanics, your plumbers, your electricians, your veterinarians,
I go
your
straight the easiest ones and the ones you have encounters with on a regular basis if you're shopping is your butchers and your fishmongers.
There you go.
What looks good today?
That's right. If you've got somebody who that's their specialty, if they're the butcher, the fishmonger, the vegetable purveyor, they know their stuff because that's what they do.
They know what just came in.
They know what looks. They know what's fresh. They know what looks good. They know where it came from.
Yeah.
We have a similar. We here as brokers have a similar concept. It's just we're not as material as a trout.
No, we're not as you can't hold it, but you can use it.
Exactly, same thing with a trout.
It's services, goods versus services.
Exactly, we're a service. They're goods, and it's again bring the experts in around you.
Yeah, but the fishmonger is a really good one because I mean, we both have grown up in households that fish.
Yes,
we know that you go in, it's not supposed to smell like fish.
The eyes are not supposed to be cloudy.
The eyes are not supposed to be cloudy. So, if it's
and it goes thud, 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 and it's not dried, there's a problem.
There's a problem. So we know these things. However, we still roll up to that counter and it's like, hey, what looks good to you? Or, hey, I've got a big party.
What would you suggest?
What would you suggest?
Yeah. Hey, can you get me a suckling pig because I'm going to do a pig because I want to roast a pig. I want to roast a pig.
Yeah, do this. What is it? The standing rib roast.
No problem.
And putting that order in a timely manner.
Yes, the timely manner is important. Respect your experts. Don't expect them to be able to pull stuff out of their butts.
Yeah, your experts, there's limitations to everything. I mean, you're not going to get, rolling in, July. It's like, oh, I want a turkey and all the trimmings. Not necessarily going to find that too easy.
Well, frozen turkeys are pretty easy. Fresh turkey, that's not such a
thing.
You can't roll in to your butcher shop on July 3rd and say, hey, I want to roast a pig on July 4th and be able to get something.
Yeah.
There's a process to complicated situations. You could roll in and get a bunch of steaks. That's usually not a problem. Because it depends on how many.
It depends on how many and what cut you're doing. It's like, I want those awesome tomahawk steaks I hear.
And I need a dozen of them. That's going to take that takes time. You can't expect immediate. You can't expect your experts to pull stuff out of their butts. If you do, it's going to be poopy.
Yes. and
sorry, I cracked myself up.
Yeah. So don't mistake, what's limited knowledge you have for what the situation is.
And limited knowledge is not ignorance.
Yeah. It's you understand some of the we've had some doozies walk in the door that have, I've been in the healthcare industry for 30 years.
Yeah. I had a nurse in the other day. It's amazing what kind of value nurses and other healthcare, they have some great insights, but this isn't what they do.
They don't do insurance.
But they are smart enough to come to somebody who does. And between the two of us, we can usually work out something perfect for them.
Or we talk to a lot of, property people.
Yes. Another good opportunity.
And that's one of those people that's like, hey, what's going on in the property industry? Well, this is what the industry says. I keep a little bit of breast on it because I am licensed in it. I do occasionally get someone running through my door. I need this, and
not commonly, but occasionally.
Usually it's friend of a friend sort of situation, because there was at one point one of the realtors discovered that I became their go-to person because I could write anything.
You've got some access.
I've got some access. I understand how things work, and I study up on it.
I call them my virtual crowbar for a reason.
You want to find those virtual crowbars in your life, because it makes your life a whole lot easier, and you're going to spend a whole lot less money.
Oh yeah, ultimately.
For example, we know that the out-of-pocket maximum is around $8,500.
Yeah, I think the maximum for
it's $8,550
this year. Yeah, and that's gone up over the years, but that's to be expected. But what you're looking for is people get focused on the deductible, get focused on the out-of-pocket maximum.
You used the D word. Okay, how someone can tell me that they don't understand insurance and talk insurance in one word is they focus on the deductible.
Exactly.
Because in the last 10 years, particularly with health insurance, there are so many things that happen prior to deductible.
Most plans have at least one benefit, usually at least two, that are deductible waived. Even the worst plan that we have on the exchange here in Chelan County this year has two benefits that are deductible waived, two usable benefits. I personally won't sell that plan to somebody unless they're desperate. Mostly because it is deductible first for even some of your most basic stuff, but there's 25 plans available. The 24 other plans have at least three benefits that are deductible waived. Things like your doctor visits, your urgent care visits, your prescriptions. Those are your base ones. As you spend a little bit more for your plans, you have more usability, and that's what I call it. It's usability, the deductible waived benefits. Sometimes your deductible waived benefit is a specialist visit. It's never emergency.
Here's the thing. We had an insurance carrier in this state that rolled out a zero deductible plan.
That's correct.
So the whole, they're all high deductible got chucked out the window.
Oh, yeah. And we're not in Dutchess Chelan County. There's another one in Washington State, outside of our area, that's a zero deductible plan. Basically, what you've got is a laundry list of copays.
It depends, because there's you can hit some with cost sharing.
The one that we have locally is cost sharing on X-rays and outpatient surgery. It's a 50-50 split. Everything else is copays.
That's coinsurance. I'm talking the silver level plans with the high enough cost sharing.
Oh yeah,
that it tags out the deductible.
Oh yeah, that's huge.
And that is based on what customer's assets versus customer's needs. We run into those plans on a fairly regular basis. It's like, well, this one, you pay nothing to see your doctor. You just wave them the card. Woohoo. There's other plans out there that, because of their income, they sat there and it's like, woohoo, I've got a $600 out-of-pocket max. So when someone says, oh, hey, I'm focused on the national average deductible of $4,000. Well, that's nice. Tell me about the actual situation you're in. I know that there's about 20% of people that are out there that they feel they don't need insurance.
Yes, we've run into that, and then they break their leg,
and then or they have that trip to the ER and discover they spend $9,000.
It's complicated.
It's complicated, and it's complicated enough that you shouldn't be riding around without insurance.
And the gal in Kansas had a complicated situation. It was a multi-tier situation that if she'd been working with a broker, probably could have worked around a lot of the problems.
Oh yeah, and given her a bunch of insight. We have folks that go in, we walk them through a plan and walk them through the understanding once, and boom, they're rolling for years.
Oh yeah.
We have others that we will see them and we will walk them through their plan 4 times in a period of 3 months.
Oh yeah.
And
that's what we do.
That's what we do. Do not be afraid to, it's like, hey, I wasn't taught this in high school. What do I do? Or, there are some people that are sitting there, swiping right in high school. Well, they should be paying attention to what's going on in class.
You shouldn't be swiping. You shouldn't be on those apps when you're in high school.
shoulda, woulda, coulda.
Yeah, I know.
It happens. So here, don't be afraid to be the dumbest person in the room.
No.
I frequently strive to file your taxes.
Mm-hmm.
Don't
We're getting into that season.
We're getting into that season.
We'll talk 1095s later.
It's actually that starts next week officially.
Yeah, we'll talk about that next Thursday probably.
Don't be afraid to roll up and have someone else file your taxes.
No.
Because that stuff's complicated. You want to make sure it's done right. You want to make sure it's done electronically.
Mm-hmm. Especially right now. The IRS is behind.
I want to say they're about, it's somewhere between 1 and 3 million applications behind.
Yeah, so if you can do it electronically is the key with an expert.
With an expert. With your banking information.
Yes, that will make your life so much easier. Do direct deposit.
And file on time. Mm-hmm. I had someone say, oh yeah, I filed last July and I still haven't received it. And I'm like,
well, yeah, that probably has something to do with it.
It's like, yeah, you're going to the back of the line. Mm-hmm. And yeah, you did it yourself. And you didn't do it electronically. And it's just like, dudes, get some experts around you.
It is sitting in a bin in the mail office of the IRS. It's going to take a while.
Yeah. That's why they're hiring for it. So yeah, don't be afraid to collect the experts around you.
No, do not be afraid.
Life is not a do-it-yourself experience.
Oh.
You're not on an island. It does take a village. And
there's no shame in it.
And there's no shame with it. It's like, hey, I need some help.
Yeah, okay.
Get some help. Collect your experts. Hey, have a good week, and we will talk to you next week.
Bye.
Bye.